Oh, sure.
We'll just start off by asking you what your current symptoms are.
Current symptoms is a tight lower back and a weakened leg and calf, and the numb toes. The last two, the pinky toe and the second to the last toe, are numb.
And how long have you been dealing with those symptoms?
Since summer of 2022.
And before that, you had, some experience with back pain,
Yeah,
but not to this extent.
Mm-hmm. Yeah.
And so what course of action did you take after the summer of 2022 as far as treatment is concerned? You mentioned a few things.
Did some chiropractic adjustments, and then I had one specialty where it was a decompression table that it helped too. And then I took steroid shots, one steroid shot. Had an MRI to scan how my spine looked, and did a couple of sessions of physical therapy.
Yeah, and the MRI revealed some areas of compromise in the disc.
Yep, that as the spine went lower, the disc was smaller and smaller. Especially the last one was really, really thin.
A lot of narrowing in that area. So what happens in that case, you get a lot of compressive forces that are bearing down not only on those disc structures, but also the nerves exiting.
Yeah.
With you, it's been a lot of sensory deficit, probably less in the way of like motor weakness or strength, but you've also noticed a little bit of that too, especially with quick movements.
Yeah.
Gotcha. Of all of those treatments that you mentioned, was there anything that was like somewhat helpful?
I would say the decompression table.
Yep.
It's just that it takes you sit on the bed for 20 minutes and it's like 24 sessions or something, but you slowly stretch and stretch.
Mm-hmm.
And then when I did get up, I felt tingly, like it was kind of coming back to life. It was a good feeling. But so I felt like out of everything, that was the one
most
that helped.
useful.
Yeah.
Okay.
Mm-hmm.
All right. And so how did you learn about this procedure?
YouTube.
Okay.
Yeah, YouTube. That one big channel, I think he's in Texas, but I just searched up reindeer near me.
Yeah.
And then I searched up and had that same procedure.
Awesome. You're gonna feel the legs start to go up.
All right.
Get this set here. Now it feels okay so far.
Mm-hmm.
What we're going to do we'll get these pins set, and then I'll kind of take the slack out. They're certainly going to be snug, but if there's like any unusual like pinching anywhere or unusual skin pull, just let me know, because I can pull them out and just kind of readjust them a little bit.
Okay.
You're just going to kind of keep your hips down on the table there.
Okay.
Let's go that way with your body. A little bit more. Perfect.
Arms up here better?
That is good for now because they're out of the way with me getting these set. But when I get them set, you can put them down there. You can kind of interlace them together. So let's go up this way.
Okay. Oh, I see.
Yeah.
The hip bone. Okay.
Exactly. So, you have kind of this small window between that hip bone and that bottom rib. That's where we're aiming. Okay. Keep your hips down.
Okay. All right.
I'm going to borrow your hands here momentarily. So grip my hands. Kind of grip them. Good. Keep your arms loose.
Okay.
Good. Feel like you're snug in there?
Yeah.
Good. And that should be pretty comfortable on the neck. Just do your best to kind of relax your legs and then breathe in through the nose, out through the mouth.
Oh, sure.
Yep.
Oh, shoot.
Just keep breathing.
Oh my God. Wait. Oh my
In
God.
through the nose, out through the mouth there. Yeah, that was pretty good, huh?
Oh my God. Oh, it has been, that has never cracked down there before.
You got some good movement down there, yeah?
It's never cracked down there before, ever.
Awesome.
Oh,
That was very good.
Oh, shoot.
Just let you kind of get yourself together there.
Okay. All right.
And that's it. That was pretty quick, right?
Okay.
Yeah.
Yep. I thought you weren't gonna pull it. It was 'cause it's so tight.